Hello, everybody, and welcome to our session. My name is Daryl Gordon, and I'm Vice President of Marketing at MediKeeper. We're excited to have you joining us today. A couple of quick housekeeping before we dive into our session. We do have a large number of attendees today, so we're going to use the Zoom functionality within the chat functionality within Zoom, and you'll find it right at the bottom of your window. At any stage, as our presenters are talking, go ahead and submit a question, and we'll have enough chance to respond to those questions. Our session today is planned for 25 minutes. If by any chance we don't get to all your questions, we will follow up with you afterwards. Today's topic is mental health, the great resignation, and quitting. Our presenter today is Dr. Tyler Amell. He's the Chief Health and Strategy Officer at MediKeeper. He's an internationally recognized thought leader on the topic of workplace health and productivity. And we're very proud of our ongoing series of educational webinars. If this is your first time visiting us, I hope you will join us for the next one. Dr. Amell, I believe you have a very special guest to introduce to our audience.
Yes, I do. Thank you very much, Daryl, and good morning, everyone. So my guest today is my good friend and colleague, Ryan Picarella. He wears a few hats. He is the CEO of WELCOA, and he is also involved with a few other organizations as well, which would be great to hear from him as we go through today's session. Now, the focus of today's webinar is really around mental health, and we're going to dive into that from a couple of different perspectives. Prior to doing that, though, as is customary, we do like to cover off on our affiliations and disclosures so that everything is quite transparent. I wear a few hats myself. I'm the Chief Health and Strategy Officer at MediKeeper. I am also on faculty at Pacific Coast University for Workplace Health Sciences. I run the work in the workplace side of that house, as well as registrar functions, and teach a fair number of courses. And I also sit on the executive board of the National Wellness Institute, as well as the Work Wellness Institute. Now, Ryan today is joining us with wearing two hats and probably a couple of others that he will describe. So he is the CEO of WELCOA, as well as the founder of Conscious Disruption. Ryan, would you like to say hi and introduce yourself?
Sure. Thanks, Tyler, and thanks, Daryl, and thanks to MediKeeper for having me. So it's great to be here. As Tyler mentioned, the CEO of WELCOA. Super stoked about today's topic, and mental health has been really a big focus and passion of mine for a while, and how it relates to organizational culture. So just appreciate the opportunity and looking forward to the discussion.
Excellent. Thank you very much, Ryan. My email is up on the screen, as well as my LinkedIn. Please feel free to reach out. I post regular content on workplace health and productivity, wellness, occupational medicine, work disability, pretty much everything to do with health in the workplace. I put up Ryan's email. Hopefully he's okay with that. I didn't clear it with him.
Absolutely.
As well as his website for consciousdisruption.com.
Yeah, if we don't get to anything today, feel free to reach out to me. Happy to answer questions directly or connect with any of you guys. So thanks for putting it up there.
Excellent. Thanks, Ryan. And we're the only thing sitting between Ryan and a quick little vacation to Florida right now. So I know he's going to be keen to answer those emails and get them off of his desk. So as is customary at this point, we talk a little bit about some past educational content. So the February webinar for MediKeeper was answering the question, what are employers looking for in wellness right now? And we had the team from Viacity and Primera Health and one of the Blues with us. And I also spoke at an HR.com event, HR West and Empower HR Tech Americas in the Bay Area. I covered what does the research say about stress, burnout, anxiety, and depression in the workplace, as well as a second talk on digital well-being and the modern workforce from on-site, hybrid to fully remote. Now, from the future side of things, obviously today we're dealing with a fireside chat with Ryan. I do occasional webinars with employers. So I'm doing one at the end of the month for a large employer on the East Coast. It will be spoken specifically on sleep health. At the end of the month as well, I'm doing a keynote for the Workers' Compensation Institute. That's going to be on steps to prevent serious workplace injuries and fatalities. That'll be a very interesting one. An IFEBP webinar, so that's the International Foundation for Employee Benefit Plans, giving a webinar myself on the research and science, as well as I'm being joined by a couple of lawyers, which will always be fun to talk about the 4-day work week and basically dispelling, is this a real option for employers or is it all hype? Now, then our next MediKeeper webinar will be on next generation biometrics. This is going to be quite interesting. There's been lots of advances in the fields as we pivot away from on-site types of services, and there's some really neat things that can be done now. But the highlight coming up in September of 2023 is the WELCOA Summit. Ryan has been gracious enough to invite me to speak at the event. I'll be covering off on evidence-based wellness and looking at the science behind behavior change. And Ryan, here's a great opportunity for a plug for the summit here.
Yeah, thank you. If you guys are, are looking for an event of the year, this is going to be it. So this really is, we've got an incredible lineup of speakers, and really the focus is on experience. So providing you all with kind of self-care. We've got everything from musical performances to art installations to some of the top speakers really in the country and in the world. And it's all main stage, so no breakouts. Is really going to be a pretty amazing experience. So I encourage all of you to go out there. The agenda is out on our website, welcoa.org. Just click on Summit and you'll be able to see it out there and see Tyler joined by some amazing colleagues. So really focusing on a whole diverse group of topics to really help give you all the information, and really more importantly to have a really great time there, a great experience, and to come back energized to continue all the great work that you all do. So hope to see you, and it's in San Diego, right? So how can you go wrong with San Diego? I can almost guarantee it'll be sunny, beautiful, and weather will be great. So hope to see you guys there.
Great, thanks, Ryan. And I'm in San Diego right now, and I can attest it's usually pretty consistent. All right, so there's been a lot of talk about mental health as of late in the past few years, particularly since the pandemic. Now, leading up to the pandemic, we've been chipping away at the stigma associated with mental health, particularly in the workplace, and so that has gradually been unfolding before us. Now, mental health is not a new concept by any means. In fact, May is Mental Health Month, and this has been a focus since 1949. So this is not a new issue. It's been overshadowed. It's been swept under the rug from an employer's perspective for a long time due to a variety of reasons. So when Ryan and I were discussing potential topics for this webinar, naturally mental health really came to the top of the list. Now, whenever we were discussing, what we would focus in on, I made the comment, how do we get employers to get their people to quit quitting? And this was obviously a play on words for the concept of quiet quitting, which we'll talk about in a few moments, because, employers want to retain talent. They want to decrease turnover. They want to be able to support their people from a variety of different perspectives. And there's lots of different strategies and tools that we know work quite well. And so, we did have a little bit of a play on words with regards to the concept of quiet quitting, and really empowering employers to really just to stop the bleed, to get people to quit quitting. And then that broadened into this concept of, okay, well, we've got this great resignation going on. I, for one, am not a big fan of this term. I think it's a little bit of a misnomer, simply because, the implication here is that people are leaving the workforce and not really going elsewhere, when the data show otherwise. Most people are, in fact, whenever they do move on to a different or they submit their resignation, they don't necessarily exit the workforce entirely. Of course, that does happen in a few instances, and that has been happening over the past couple of years, but there wasn't this great implication that everybody was just quitting their jobs and that was the end of the story. But that doesn't take away from the notion that this is quite an important issue, from an employer's perspective. Very high turnover rates, people moving from one employer to the next, perhaps seeking out better compensation, work from home arrangements, obviously benefits, and employee health is obviously at the high end of that list. And then we've got the concept of quiet quitting, and the more recent term of bare minimum Mondays. Now both of these are employee engagement issues from an employer's perspective. People, essentially working to rule, doing the bare minimum required, not necessarily having that high level of engagement that employers had been seeking. And this is reflected in Gallup numbers and a few other engagement indexes out there that show that we've got a pretty significant decrease in levels of engagement out there. And there's lots of reasons for this. We've got, obviously, inflation is a big issue right now. Climate change is very real. People are quite worried about their future. So this does permeate their own mental health. Of course, we've got violence issues. We've got threats to democracy, both here and abroad. And one of the topics that is the subject of a couple of upcoming papers and presentations from me is where we have gone and where we've arrived at from a compensation and a pay perspective relative to productivity, because we cannot discount the fact that we have seen tremendous increases in productivity as of late, and that is reflected in the technologies that we see and the tools that we use and our ability to get the job done. Now, compensation has not necessarily kept pace with that as of late. So if we look at these data here from the Economic Policy Institute from late last year, you know, from 1948 and right after World War II through until around 1980, wages and productivity kept pace with one another. So as productivity increased, workers were rewarded. Now, in around 1980, we started to see a divergence. So productivity continued to increase and increased rather substantially, but wages never really kept pace whatsoever. And now we're seeing a rather significant gap between those two. And this is permeating a lot of conversations out there. It's contributing to lack of engagement. It's impacting people's health from a variety of different perspectives, because there's anxiety and there's stress. In many instances, there's depression that goes along with that as well. So really, you know, we have these significant issues all happening at the same time, which are impacting worker health. So now, from my perspective, you know, Ryan, what are your thoughts? You know, how are businesses responding to all of these drivers, and really developing that business case and need for better mental to support their people, given all these external factors, let alone the internal factors that are going on in people's lives?
Yeah, what a time to be alive, right? I mean, there's so much going on, and I appreciate your comments on the Great Resignation, and I always usually refer to it as the Great Renegotiation, right? That it's a different, that employees have different expectations now of their employer, and you know, you mentioned all of these things between the war in Ukraine, what's going on, you know, political, civil, racial unrest, all of these things, technology, what's happening. I mean, it really is fascinating, and what the challenge is that organizations haven't been able to keep up the pace with everything going on around us. And I usually, as I'm talking about, you know, mental health, I usually frame it in the context of the employee experience, and starting from how you find, you know, that employee, how you onboard them, you know, what that looks like, what their first week, their month, the training, all of that goes into, and how that's changed. And I think back to the days, and you know, I think all of our lives have changed dramatically over the last 3 years. There's not one person probably on this planet that could say that they haven't been impacted to some degree, and largely most people to a bigger degree over that. But still, the work and the way we do work and how organizations address that, typical benefits, you know, all of that has largely stayed the same. And I, you know, when the pandemic first hit, I remember asking a dear friend of mine who's a nurse, and this was at the early days when they didn't have enough PPE and it was a problem. And I kind of said to her, I said, "How's your wellness program doing?" And she looked at me and she was like, "You're kidding me, right?" And I said, "Well, no, I'm actually kind of curious. Like, how's your wellness program doing? Like, is it helping you right now?" And she goes, "Ryan," she goes, "my wellness program consists of going into a storage closet with another nurse and holding each other crying." She's like, that's our wellness program right now." And it was heartbreaking, actually. And so much work has been done to try to create these programs and try to support people in all of this. Yet when it came down to really what needed to happen, you know, it just was really falling short. And so I know, you know, mental health, I think one, you know, I would say benefit of getting through the pandemic to a degree is that it was so largely stigmatized before, that people didn't feel comfortable going to their boss or going to, you know, their colleague and saying, "I'm struggling, help." You know, so the other problem is that we don't know what happens behind computer screens, right? So if I'm sitting in the office in San Diego with you, you know, we might walk by, get a cup of coffee together. I might see you at lunch. There's a lot more social interaction. So I have a better pulse on what might be going on. But the reality is, in 20 minutes, when our webinar is over, my computer goes off. You have no idea what I'm doing at that point. And I could be really silently struggling. I could be feeling in social isolation. I could be having all these other problems, and the organization doesn't really have a pulse. Neither does management, you know, with that. And so the solution's not, you know, there's certainly a lot better ways that I think organizations, and first is awareness, right? I think it's good that we're certainly talking about these things, we're raising them up. I think people are recognizing that traditional EAPs aren't enough. Not only are they not enough, but we don't even have the clinical support to support it if it was enough. So that's also, you know, kind of problem, and really helping managers and train managers, you know, really how to identify or recognize signs of mental distress, stress, and to really start being, you know, much better at trying to help identify when employees might need help, and then really evaluating the entire employee experience, really thinking about how do we interact, what is the culture like. And I'm, you know, my love and my passion, I'm a culture guy. And so I think, you know, how are you really, and that's, you know, as a leader of an organization as well, it's a lot harder when I don't have any of my people around me. And it really have to be very intentional about connecting. You have to be very intentional about building those cultures and to really think what are going to be the benefits that make the most sense. I'll pause there. There's so much to go into this, and I could obviously keep on going, but want to make sure if there's a certain area that you want to focus on, or the audience focus on, we can dive into that.
Yeah, I agree 100% with all of your points, Ryan. There's some really interesting things there to unpack. There's a reason why, if we look at engagement indexes, there's a question in there around, do you have a best friend at work? Reaching out, touching somebody, having that conversation, asking how they're doing. Because you're right, it is a lot more difficult in a work from home or a hybrid working environment to get that level of connection. But, I think there are some success stories out there. People are obviously really enjoying the working from home. This is a requirement for many folks these days. There's resistance around organizations who want to pull people back into the office full time and party like it's 2020. And so, you kind of see
Still
this
going
drive.
back.
Yeah, exactly. The genie's out of the bottle in that
Yep.
respect. Now, from your perspective, are the solutions, are they digital in nature? Are they cultural, or is it a combination? Because it's hard to reach those people historically when you may have never met them in person. It's tough to develop that bond. We're social animals, we're social creatures, we thrive
Yeah.
on that. The majority of the population does. That is, there are a few folks who don't like people and tend to stay away from that, but at the end of the day, most of us do like to have that contact.
We are, and I think there are some great success stories. And I got to be honest, even myself. I mean, it is nice to be able to work from the comforts of our home at times. There is a balance, but there is no solution to being together in person. I think the first time going back to a conference and being around that, or going out and having social dinner, it's like, man, you forget how much you sort of missed that. And so I think certainly for some organizations, WELCOA is now a complete virtual organization as well. So we've got folks all over the country. We are actually going to San Diego as an entire team next month to do our conference scouting. So I think it's important. It might not be all the time, but bringing the team together in certain ways, building in time for connection and networking. And it's funny, remember at the beginning of the pandemic, there's all these happy hours and cooking classes that we would do. And, that could get fatiguing as well. If you're spending 8 hours on Zoom, the last thing you want to do is spend another hour on Zoom after that. And so I think there has to be a balance and how it's structured. And yeah, I think it's all culture. You asked about technology. Technology is an aid. And I think it just depends on, the expectation. I can tell you, I've worked for organizations where there is so much technology between project management and chats and Zooms and this and that, where it can be overwhelming and no one really knows where to go. So if you're using, a certain platform, then how do you make that really, sort of known and expected and all of that, versus expecting people to do, more than that. I do believe that there is no replacement for being together in person. And I've seen from the organizations that I've worked with, giving the employees that want to come in the option of 2 or 3 days a week. And the foundation that you mentioned, they go in Tuesday, Wednesday, and Thursday. And, Monday and Friday are optional days. And that seems to really work well for them. One of the things that it sounds very simple, but at WELCOA, what we suggest to our members is, ask. Have you asked? What's going to work? And not that you can do everything that they ask for, but how many people do want to come in and provide, and what job functions might have to go in, and others might be more likely to be remote. How are you communicating that? And is it fair and equitable across the organization? Is obviously really important to make sure that no one feels left out, or they have to go in there and other people don't. So I think all important considerations.
Yes, yes, most definitely. And I think you raised a really good point, asking employees, what their desire is, because at the end of the day, modern organizations, for the most part, outside of very niche industries, the people is what make up the organization, right? That's where the true value in the organization is in the people that make it up, what's between the ears. And if you look at, valuations of organizations, it's often discounted, but in fact, it's one of the most important things, because a quickest way to kill a culture or to kill an organization is for key people, key thought leaders, key decision makers, the people that make up the organization. When they start leaving, that's usually a hallmark for things not boding well for the future. So, what are your thoughts on that? How are you measuring culture in relation to health, and does it permeate beyond the concept of health? Because you and I have been in this business a long time. Health historically has been an afterthought. It was never a key driver from an organizational success perspective. perspective, the pandemic changed that to a certain degree, but it's still not, number one there. You still have organizations out there who aren't necessarily buying into the fact that the health of their people should be of importance for organizational success. So what are your thoughts on that?
Yeah, good question. And to your earlier point, I think in the absence of information, right, people make up their own stories. And so really getting out in front of communications, if you have, those changes, and again, related to technology, I've seen some great tools out there that do more pulse checks throughout the organization. And to me, those are more of the leading indicators of bigger health problems that could exist, things that could, result from stress and just asking people how they're doing. I mean, it's very, and again, it's funny that health was always the afterthought when it really should have been, the forethought. I mean, how do we really structure and create systems within our organizations that really are more conducive to better health? And so I think it's constant communication, constant pulse checking, and that's where technology can really be helpful. Being incredibly intentional about how you structure that. I mean, WELCOA has, as you know, the Well Workplace Checklist. There are organizational tools out there. Heroes got their Hero Scorecard. NWI's got great resources that, as well, to kind of get out there and to do some of these broader organizational pulse checks, which is good. And that provides a sliver of the pie, then also really finding ways to get, again, I don't think a once a year health risk assessment that asks, are you stressed today, is the answer. And again, there's utility there, and there's, but asking someone once a year if they're stressed isn't going to help. And so how do we build in these other mechanisms within organizations to really make sure that that leaders do have a pulse and that we are communicating this? And again, there's a lot out there, and that's where I think, technology, it doesn't have to be long. How you doing today? It could be one question, and that means that one question can really speak to a lot and really be one of those leading indicators of poor health or stress, within the organization.
Mm-hmm. Yeah, I agree 100%. And particularly around, the once a year health risk. Well, yeah, you can see that from a benchmarking perspective, but you want to be able to drive and guide behavior change and sustainable behavior change over time. And once a year check-in is really not best practice there. I once saw an instrument a couple of years ago that was just happy faces and sad faces and neutral faces, and they were soliciting input from employees. Just, how are you doing today on the employee portal or on the employee app, which I think was quite interesting.
Yeah.
Now we're coming up on time. We could spend days on this. What about things that don't work? If you had to give advice to an organization saying, "Hey, listen, we believe that mental health is an issue here. What pitfalls do we need to stay away from right from the get-go?"
I think probably, and this kind of speaks to some of the question about the wellness, assuming that what you have is working, or that EAPs are enough, or that you're traditional. And I encourage all these folks that, what you had in 2020 or 2019 is probably very different than what you need today. And so what doesn't work is just, again, this is not a knock on EAPs. They can be great, really, in a thoughtful way, but just, referring people, not, following up. What doesn't work is not training management to really understand and recognize how they can support their employees. What doesn't work is just assume that business is going to be like it was, like or bringing people back. I mean, the cat is out of the bag. We're never going back to 2019 again. And so I think, what doesn't work is just assuming that we can keep doing the same things that we have, and that it will. And so I know that's quick. We're out of time. I can keep going, but I'll stop there. I want you to add anything.
Yeah, no, I think that does make sense. Now, we're coming up on time here. Is there any final words or final advice that you would like to provide to organizations as they're embarking on a challenge or looking to revisit their approach and strategies when it comes to mental health in the workplace?
Yeah, I would. This is such an important thing, and we've all felt stress. It's something that, on the spectrum, we're all feeling better some days than not. And so I think let's talk about it. Let's look for solutions with organizations that can do that. And again, we're better together. So finding ways to build in social support, with that. And what I recommend to organizations, and I literally have a map, and I'm happy to send it to you if you email me, that maps out an employee's journey. And I would start with each one of those touch points, the day of hire, first day, that, benefits, and how can you tweak that a little bit to really show, support for employees. And it's a great exercise to go through. And it really includes all of HR and everybody kind of in that, to really create an experience for employees that support their health and well-being, and certainly mental health as well.
Excellent. Very sage advice there. Much appreciated, Ryan. Daryl, are there any high-level questions that we can touch on briefly? I know we're at time right now. We seem to go right to the end here, but I think this is such an important topic. It's definitely worth it.
Well, thank you, Dr. Tyler. Just before we started, you and I were chatting and saying maybe this should be a 2-hour session, and clearly that is the case over here. So we do have a couple of questions. We will follow up with those privately online. I wanted to thank everybody for joining us. I wanted to thank Dr. Tyler and Ryan for some really great content. We have recorded the session. It will be up on our website in a couple of days. There's about 20 other sessions that you're welcome to go and look at. I hope everyone else has a great day. And this concludes today's session. Thank you for joining us.
Thank you, Ryan. Thank you, Daryl.
Yeah.
Take care, everyone.
Appreciate it.